Hello everyone, welcome to my channel. Today we have another surgery and dermatology question for step 2. If you would like to see more step 2 questions, please like and subscribe. A 59-year-old woman visits her primary care physician because she recently noticed a dark spot on the back of her right forearm. The lesion appeared approximately 5 months ago and has gradually become more noticeable. She reports occasional mild itching but denies pain or bleeding. Her medical history includes well-controlled hypertension and osteoarthritis. She enjoys gardening and spends several hours outdoors each week without consistently using sunscreen. On physical examination, there is a solitary 4.5 millimeter darkly pigmented macule on the dorsal aspect of the right forearm. The lesion has an irregular distribution of pigment with a small raised area located off center. Although the borders remain relatively smooth, multiple light brown macules consistent with chronic sun exposure are also present on the face and back of both hands. Which of the following is the most appropriate next step in management of this skin lesion? Well, first of all, we need to think about the diagnosis, right? So we have a 59-year-old patient. She has some medical history, but those are not really relevant to our question right now. The main concern is the 4.5 millimeter darkly pigmented macule that she has, and that could potentially be melanoma, but it doesn't meet many of the criteria for melanoma. Uh, the borders are not irregular. It's relatively smooth, and that makes you think that it doesn't meet many of the ABCDE criteria. But before saying that, we need to also think about the ugly duckling sign. So when the patient has multiple lesions that all look the same, but she also has a lesion that looks so much different, then we also need to think about the ugly duckling sign, which is a good indicator for melanoma. With that being said, let's go over the answer choices. A schedule repeat examination in 4 months to assess for interval growth. Well, that does seem like a correct answer, but we need to think about the fact that she has multiple lesions and one of them look different. Although this lesion does not meet many of the criteria of the ABCD criteria, uh, we might not be worried about melanoma. The ugly duckling sign is something that we need to think about. So A, I'm not very confident with it. B, perform a complete excisional biopsy with narrow margins. Well, this makes sense if we are suspicious of melanoma, and which might be the case right now because of the ugly duckling sign. But we need to also read the other answer choices. C. Treat the lesion with liquid nitrogen cryotherapy. Well, this makes sense if you're dealing with something like actinic keratosis, which usually happens in sun exposed areas and is more diffused and is more flattened compared to what we are seeing here. So this is not a really good option for us. And also, we want to collect a sample to see whether what we have is cancerous, and just removing that wouldn't help us. D. Prescribe a topical fluouracil cream. Again, similar to C, this is helpful when we are dealing with conditions such as actinic keratosis, but we're not dealing with that condition and we want to diagnose whatever the lesion we have here. E. Obtain a superficial shave biopsy of the lesion. Well, this is essentially similar to B, but the difference is with E, we don't collect as much of a sample as we do in B, and sometimes we do E because the lesion is on, maybe the patient's face or somewhere that's sensitive, and we don't want to leave a scar. But in this case, that's not the case. So I would say B is the right answer choice. Thank you very much for watching this video, and if you would like to see more step 2 questions, please like and subscribe.